So for everybody that's joined us, I'm Tracey, and we're also joined today by Auriel, who's
Oh
talking to us
yeah.
about the importance of diabetes management in the workplace. So we will be covering a few different things today around generic sickness, why it's important to manage sickness, how much of a problem sickness absence currently is in the UK. There's some really important upcoming changes to sickness absence, so we'll just talk you through what they are and how you can prepare if you don't know already, and then have a bit of a look at different support that's available, different things that can affect sickness levels, and then the legislation that applies, which I'll do as a generic overview, and then Ori will talk us through a bit more specifically relating to diabetes management. Throughout all of today, we're thinking about reasonable adjustments, how we can make work accessible for people. And then there's a couple of specific areas that I'll touch on, which are pregnancy and mental ill health. And then I will hand you over. So that's kind of the run through of where we are. As always, if you've got any questions, put your microphones on, feel free to ask them as we go, and we will watch the chat box as well. So if there's anything you want to ask on there, please do. So why is it important to manage sickness absence within your teams? So, oh, sorry, I just had a random slide pop up there. So failure to manage sickness absence has got lots of different consequences. So it can result in a reduction in productivity. It can affect morale, obviously for the person whose sickness isn't being managed, but also for the people who are sometimes affected by poor sickness management. There are financial implications. So obviously, sick costs you. And there's also the cost of cover, there's the cost of training, there's kind of the secondary costs that sometimes go with absence. Continuity of service, it will affect your customers, it will affect your productivity, it will have an effect obviously on all of the services that you provide. Employee well-being speaks for itself. And you may have a lack of workforce. So there might be times you can't physically deliver the services that you need to, or you can't physically kind of run your company. So sickness is a big problem in the UK, and it is currently at its highest rate that it's been in the last 15 years. Sickness is currently averaging 9.4 days per employee per year. So, on average, for every full-time member of staff that you have in your company, you're losing 2 weeks of them nearly a year through sickness. So, that's a massive impact, as we say, on all of the things we've just talked about, and also on your business as a whole. Pre-pandemic, so going back about 6 years, it was 5.8 days per employee per year. So the figures are around about double, just under double what they were 5 or 6 years ago. Obviously, that's a trend that we hope won't continue. But if it does, you need to think about how your workforce is kind of equipped to manage those levels. There are some changes coming up, as we say. So this year's got the biggest shake-up of employment law and of employee rights that's been seen in decades. And one of the biggest changes to that is sickness, which comes in this April. So the changes that are coming in April is currently the first 3 days of sickness are unpaid waiting days. So people don't get any SSP or any statutory sick pay for those 3 days. From April, SSP will be payable from day one. So any absence, even if it's only 1 day of absence, will be eligible to receive SSP. The other really big change, which is the important one that all companies need to budget for, is at the moment, SSP is only payable to people who meet the lower earnings limit criteria. And that means, as it stands right now, they need to earn £125 a week to get SSP. From April, that limit will go. So statutory sick pay will be paid at the SSP rate or 80% of wages, and it will be the lower of the two. So that means even the staff you have in your teams who currently don't qualify for any SSP from April will receive 80% of their wage. Now, that means you need to be budgeting for those people who might never have received sick pay before. So we're encouraging people to look at your return to work interviews, look at your absence management processes, look at how you record and manage data. Are you in a position to spot triggers, to spot trends? Now, sometimes inevitably, people can abuse sick pay procedures. And these kind of changes may mean that people take sick now or take sick then that they don't now because they simply can't afford to. So it's very likely that sickness rates will increase as a result of these changes. Now, in some cases, monitoring your trends and your triggers can help you to spot people that genuinely need support. And that's really important to look at, if somebody's always off on a Monday or always off on a Friday, is there a reason for that? Is there some help they need? And to do that, it's really important to train your managers. You may be in a position where you're sort of a higher manager or you're the business owner and you're delegating that responsibility to others. And it's really important that they know what they're looking for and they know how to manage it. Now, there's obviously different types of sickness which fall into short-term sickness, which can be usually up to 4 weeks. And where it's short-term sickness, it's very often minor illnesses, so flu, colds, minor infections. It's often a one-off. So your people that are short-term sick normally have a couple of days off sick and then they come back. You've also got long-term sickness, which is where it hits a month or over 4 weeks in length. And very often, as we'll talk about a bit later today, that can be connected to more serious illnesses or more long-term conditions or disabilities. And sometimes those patterns can be reoccurring or can require ongoing support or treatment. People can self-certificate for 7 days, and that isn't changing under the new legislation. So there'll be no requirement to submit doctor's notes until day 8, even with the new changes to sick pay. And then any sickness from day 8, and remember that's calendar days, not working days, needs to be covered by a statement of fitness for work. So people need to be sending you in a doctor's note if they stay off after that period. Now, there's lots of different things that can affect absence levels. So the first one obviously is illness and ill health, physical conditions or mental ill health. And absence can be split into either category. Very often it overlaps where somebody may have poor mental health because of a physical condition or may have physical symptoms, physical sort of impact of poor mental health. So very often you'll be dealing with both at the same time. Often external factors can cause people to be off sick. So things like bereavement, stress, maybe divorce. So some kind of external factor that's affected somebody's ability to come to work. Sometimes it can be connected to addiction. So drugs, alcohol, gambling, for example. Sometimes people will have an injury, so they might injure themselves through a sport or a personal hobby. Obviously, workplace accidents can happen. Sometimes people go sick because of relationships, so conflict, bullying, so not physical illness, but something at work that's preventing them from coming in. And that can sometimes tie into pressures to workload. So lots of different reasons that people can be off. And as a company, you will have a method as to how you calculate sickness. So the main methods that our customers tend to use would either be a triggers-based method, and that's where you would look for occasions of absence. So if somebody's had 3 occasions in 3 months, for example, or 5 occasions in 12 months, that would trigger you to look at reasons that support, why they're off. The other method is to use a formula like the Bradford factor. And Bradford factor works on a formula of S times D, which is the spells times the days. So if somebody has 1 occasion of 4 days, their formula would be 1 times 4. And that gives you a number, and you would then have a trigger point at which you would call them in, have a meeting and review it. Either option is absolutely fine. It's really what works for your own business. But the most important thing here is that you have got a method of picking up concerns. Now, Disability Discrimination Act will feature into a lot of what we're talking about today. But the DDA or the Equality Act of 2010 would count you as disabled if you have a physical or mental impairment that has a substantial and long-term effect on your ability to do normal daily activities. Now, substantial means it is more than minor. So somebody that has a very minor impact wouldn't be covered at all. But if somebody has an effect on normal day-to-day activity, then it would count as being a substantial impact. And long term generally means 12 months or more. There are exceptions to that, and there are things that fall under different categories. So where there's progressive conditions, things like MS, cancer, Parkinson's, motor neurone, they are covered from day 1 of diagnosis under the Equality Act. Now, we always say to people, when you're managing absence and when you're managing sickness, manage people fairly, regardless of whether they're covered or not. Don't tie yourself up in knots thinking about the Equality Act. Manage your people fairly, but think about what they need on an individual basis. And it's really important here not to fall into the stereotype of, well, all staff with MS need this, or all staff with diabetes, as Auriel will talk about later, need this, because every person's needs are individual. Now, what you may find as a result of the Equality Act is that you're asked to consider reasonable adjustments, and they might come in through a GP or a fit note. They might come in through occupational health, expert services, so counsellors, consultants. Sometimes they come in through the individual themselves. you might pick them up through a risk assessment. So very often you'll do a risk assessment with somebody coming back from sickness and pick up any adjustments that they need. And these adjustments could relate to anything. So it could be their hours, their workload, their location. Sometimes it's around their breaks and their environment. The law says that you have to consider them. So if somebody asks you for reasonable adjustments due to the Equality Act or under the Equality Act, you have to consider those adjustments by law. It's really important to remember that what's reasonable for one business might not be reasonable for another. So assess every case on its own merits, keep your notes, keep your documentation of your thought processes. A couple of things that kind of fall very specifically within absence legislation would be pregnancy. So generally speaking, you will discount pregnancy-related absence from reporting and monitoring. And if there's any pregnancy-related absence in the 4 weeks before childbirth, that automatically starts their maternity leave. So just a couple of kind of words of caution there. The other thing at the moment, which is an increasing concern for employees and individuals and indeed employers, is mental ill health. And mental ill health is where some part of your life is affected by something going on, and that can affect mood, thinking, behaviour. It affects your ability, as the definition says, to cope with the normal stresses of life. Now, mental ill health is a growing concern in terms of absence management, and we've got lots of resources. We've got mental ill health packs if anybody needs them to kind of help you to support those employees. We won't go into it too much today because it is a session in its own right, but just be aware that, mental health very often can have a real effect on absence levels, but also on somebody's ability to perform at work. And then some of the things we talked earlier of how workplace risks can cause absence. So some of the ones that can cause those could be poor health and safety policies, poor communication. It could be around leadership, lots around limited opportunities or inflexibility of people being able to work. And very often it's caused by pressure, unrelenting workloads, issues with bullying, harassment, issues with skill set. So if you're noticing that absence is increasing or you're picking up on absence trends as part of your return to work management, just consider whether there is any workplace things that are actually affecting that, that you could potentially quite easily change that would have a really big impact for your staff. So just a few quick tips before we hand you over. So make sure your records are up to date. Make sure you have phone numbers and next of kin details for your staff. Think about promoting health and well-being, make it a normal part of your culture. Encourage open communication. Train your managers. We can't explain clearly enough how important that is that your managers are trained. Make sure you are carrying out return to work interviews and kind of keeping on top of absence management. And most importantly, as we'll learn today, signpost to professionals. You don't need to know everything. You don't need to be an expert on everything. And sometimes just acknowledging somebody and giving them somewhere to go can have a massive impact on people that are unwell. So I'm going to hand you over to Auriel. As we say, Auriel will introduce her company and what she does, and then there'll be time at the end for any questions. So I'm just going to stop sharing my screen whilst Auriel picks up and shares hers. Has anybody got any questions at the moment or anything you want to cover from anything that I've run through just while we switch our screens over? No, you're all quite happy. Excellent. Okay, well, if you think of anything, as we say, you're welcome to pop them in the chat or just stick your microphones on.
Okay, I'm just getting bear with me, folks. Good afternoon, and thank you for waiting. Just bear with me whilst I just share my screen with you, folks. So I know you've given up your wonderful lunch hour probably this afternoon to speak to this blonde lady on the Isle of Sheppey about diabetes. So that's the one I wanted. There you go. It always helps if you start at slide 1, doesn't it, folks? Let's go back. Okay, first of all, can everybody see my presentation on the screen?
It's not up just yet. I think it will
Not
take
up
a
yet.
second.
It
There
should
it
be.
is. Yeah.
It's lovely job. Okay, well, good afternoon, folks. So, I'm Auriel Wetherall, Flourish with Type 2, and I'd like to speak to you this afternoon about diabetes in the workplace. So today isn't about awareness posters. What it is about risk and exposure. So leadership, responsibility, and how to unmanaged diabetes quietly impacts performance, absence, and compliance. So thank you for having me. So I'm Auriel Wetherall. I'm a quality and compliance advisor for diabetes in the workplace and somebody who has lived with type 2 diabetes for over 2 decades. So today what I'd like to do is bridge the gap between legal reality and workplace reality to help assist your company meet their legal duties. So this session will explore why diabetes matters in the workplace, the implications for HR, and what practical and real world support actually looks like. So, just to let you know, I don't replace HR teams, medical or legal teams. I guide, audit, and facilitate. So let's have a look at what we're going to cover this afternoon. So today, what we'll explore the often overlooked operational and cultural risks of unmanaged diabetes in the workplace and how these risks show up in real world performance and absent patterns and why this matters. So strategically, obviously for HR leaders. And what I'll also do is I'll outline a structure, evidence-based framework designed specifically for organisations, explain what makes this approach different from generic wellbeing programs and share the measurable outcomes businesses can expect when diabetes risk is addressed proactively. What I will do, folks, I will give you the opportunity to ask any questions right at the very end. But if you've got anything that's burning in the back of your head that you want to ask, then please just by all means call out and I'll do my best to answer it for you. Not a problem. So let's have a look at what risk is. Well, under the Equality Act 2010, which I know Tracey shared a little bit about, diabetes can qualify as a disability where it has long-term impact, a bit like mental health, for example. And this creates legal exposure if adjustments are not considered. But beyond legal, there is also an operational risk as well. So what we can do today is we can explore the hidden operational, financial, and cultural risks of unmanaged diabetes in the workplace and how they show up in absence, performance, and leadership and strain. So, like the Bradford tech formula that Tracey mentioned a moment ago, it can be somebody who has diabetes. An ordinary person might take a week to get over a cold or a flu, but somebody with diabetes can take a lot longer. Or if there is a bout of flu or something like that going around the workplace, they're more susceptible to catching it. So, with 1 in 16 people in the UK living with diabetes and many more undiagnosed, the Equality Act 2010. So, failure to make reasonable adjustments can lead to uncapped tribunal claims, rising costs, and reputational damage as well. So, what I'll do is I'll share a structured, evidence-based framework that explains making a difference from genetic well-being programs and shows the measurable outcomes organisation can achieve by managing diabetes proactively. So let's have a look at how the risk appears in real life. So yeah, there you go, employee with recurring absence that we spoke about a moment ago. So risk often shows up in everyday situations rather than dramatic events. So again, somebody that has diabetes can also might be affected with things like mental health. And if that person's diabetic and they're pregnant, that can also cause other issues and menopausal issues as well for people as well. So it does show up in everyday situations rather than just at a dramatic event where somebody conks out at work and you have to call the ambulance. So an employee may have recurring absences or performance dips while the managers are unsure how to address the health managers and avoid conversations. So without support or adjustments, formal warnings can be issued, which may later escalate into a disability claim. So these situations usually arise not from malice, but from lack of awareness. And this is where operational, legal, and cultural risks can actually crystallise for HR. So what are the operational risks then? Well, operational risks arise from diabetes, affects workforce performance in ways that are not visible in data. So increased sickness absence, pre-absenteeism, quiet underperformance, and inconsistent manager responses all add up to the strain. Now, blood sugar instability can impact mood, resilience, and also mood decision making as well. So it could mean that somebody suffers from what we would call, in layman terms, as something like brain fog or mood swings, and they can often show up in day-to-day conversations rather than formal HR metrics. So, reputational and cultural risks spike when employees feel unsafe to disclose diabetes. They might think, "Oh, goodness me, if I tell them that I have to, I have to go for a wellness meeting with my doctor every 3 months and I've got to take a day off," they might think, "Oh, they're not worth employing. They're a bit of a pain in the neck. We might need to get rid of them." And that could cause somebody not to come out and tell you that they've got diabetes. So when managers responding consistently or when there's no structure, audit trail. So if challenged under the Equality Act 2010, HR must prove manager training, documented adjustments, and consistent support, or face uncapped tribunal claims, legal costs, and serious damage to organisations' culture and reputation. So it might be, "Oh, you don't want to work for that company. They treat their employees really unfairly, especially if you have got a long-term sickness." So it isn't about being nice, it's about intelligence. And HR directors have a legal duty to support employees under the Equality Act 2010. And unmanaged diabetes can create silent exposure, such as financial risk, retention challenges, and reputational damage. It also affects inclusion strategy and leadership accountability. Addressing diabetes proactively ensures compliance, protects the business, and also strengthens organisational skill as well. So the framework that I provide, what I do is I work with HR teams to ensure policies are effective in practice, starting with a policy gap review to identify where adjustments are needed. I then assess day-to-day processes to make sure policies are being applied consistently. I provide practical tools that make compliance visible and usable, alongside awareness materials to support staff and understanding. So finally, what I would do is I'd create a clear audit and evidence trail so that organisations can demonstrate legal compliance confidently. As I said earlier, I don't rewrite policies, I strengthen it. I guide, audit and facilitate HRT teams to translate policy into action and reduce organisational risks. So what makes me different to the others then? So what makes this approach different is that it combines over 2 decades of lived experience with an evidence-based behavioural approach, all through a commercial lens. It's designed specifically for HR teams, not clinicians. So it focuses on operational and compliance support rather than medical advice. And this is real-world guidance grounded in how diabetes actually affects employees and workplaces, making it practical, actionable, and risk-focused. So just to give you a little bit of background of what I do, I haven't always been an advisor for diabetes. This is a new business that I've come into in the last 2 years. But what my background is driver training. So at the moment, I'm a driving instructor, and I've done that job for over 22 years. In the last 12 years, I've been in classroom presentations and dealing with clients that have been caught breaking traffic rules. So I'm very used to dealing with people that don't want to be there, but need to have that information eked out of them. And also it needs to be recorded and things like that, and strict guidelines, be followed. So that's helped me to set up the program that I've got. So the outcome is proactively supporting diabetes, include reduced legal and operational risks, constant management practice, a strong audit trail, improved employee stability and protected performance. When diabetes is ignored, small issues can escalate into uncapped tribunal claims, reputational damage, and costly legal exposure under the Equality Act 2010. So proper support stabilises performance and protects the organisation. Ignoring it allows risk to accumulate silently. Okay, so we know that compliance protects you, clarity protects your managers, stability protects your employees. And this is exactly what this framework delivers. A way to demonstrate legal compliance under the Equality Act 2002, reduce operational risks and embed constant confident management of diabetes in your organisation. Ignoring it, as we know, leaves you exposed. And I'll now open the door to some questions. If anybody's got any questions they'd like to ask.
If nobody's got any questions now, what we'll do is stop the recording
Yeah,
and
I have
finish
a
off.
question.
Oh, you
Sorry.
have? That's fine.
But
Yeah,
you know me. I can't get the hang of my blooming headset to
that's all right. We know
unmute.
you're there. We can hear your voice. How can we help?
Yeah, hold on. I'll just turn that off so then you can
Oh, there
see
you
me
are.
as well. Hello, hello, Auriel.
Hello, how are you?
So I know you're focusing on the type 2 there,
Hmm.
but as a first aider and also an HR manager, type 1 and type 2 obviously are different things.
They are.
They both fall under this category, don't they? And
They
they
do. Yes.
as
Yeah.
recognized as a disability. Um, but I there's not really any limitations to what people can do. It's just being aware, isn't it? Of
It is, yeah, you're absolutely right. And most people with diabetes, whether it's type 1 or type 2, the reason I focus on type 2 is because I am a type 2 diabetic, but
yeah,
I've got close family members that are type 1, so I know it is completely different. And we all manage our conditions and our diabetes differently. But the most important thing is for you to be aware of it at work and for them maybe to have a diabetes buddy if they're doing a night shift or something like that. So that, hang on a minute. Fred's over in the corner there, looking a bit confused, and he's sweating from head to toe. I'll just go and see if he's all right. Does he need a bit of sugar? So it's those kind of things that can help because if people don't know, they might think, "Oh, Fred's acting a bit odd. He's acting a bit strange," and then all of a sudden, Fred conks out on the floor, and then
yeah.
that puts you at risk and your company at risk.
Yeah, and
Okay,
sometimes
so
it's having those conversations with people, isn't it, through risk assessment to say, what do you want
Yeah.
us to do if you do
yeah,
this or that?
we were discussing this the other day because we were also discussing obviously GDPR and
Mm,
confidentiality and who should know and who shouldn't know and
yeah,
should first aiders all know in case Fred keels over,
Hmm.
or is it the choice of the employee to say whether they have it or not? Is there a
There's no legality that somebody has to say I'm diabetic, but it is within their um safety really to mention it, especially if somebody's driving or, they've only got to mention it to HR. And again, that's something I can help with. I do clinic days where I can have, you know, confidential meetings with clients and do all the paperwork for the HR so you can put it straight into their file.
okay?
Just so you know that they've got diabetes. So if anything happens within the workforce, and again, you just want to say to them, we're here to support you so we know how we can
Yeah,
support you if that actually sort of happens for you. So it's more of a if you tend to say we're here to help, it's a support because a lot of people tend to get a lot quite concerned with letting HR know that they have got medical conditions
yeah,
because they think, oh goodness me, they're going to think, oh goodness, they're a diabetic. We can't promote them to shift leader in the factory because they're in charge of machinery and we don't know if they're capable of that. But if somebody's not had any hypo episodes at work or anything like that, there's no reason as to why they can't do that job. And I think a lot of people get concerned with opening up.
yeah. No, that's what we wanted to just clarify because if they do open up, what are our responsibilities under GDPR? And as you say,
Mm.
if HR is aware of it, but someone's keeled over and a first aider goes, and then someone says, "Hold on, I'll just go and open the computer and find out if they've got anything or
Yeah,
something."
you don't do it. And again, somebody doesn't want to walk around with a little badge on their head saying, "Hello, I'm diabetic," because we just want to be treated like everybody else. But sorry, I don't know your first name. What's your first name? Apologies.
Georgina.
Georgina. So
Yeah.
Georgina, I'm going to pop my details up on the screen in a few minutes. So if you'd like to contact me, we can have a virtual coffee. If you've got any other questions I can help and support you with, or you
God
wanted to
bless you.
further and how I
Okay.
can help and support you, please just get in contact.
Yeah, that's great. As I say, it was just something that came up in a conversation on risk assessments and things like
Yeah.
that, as you said. So,
It's
that's great.
And I
I
think
mean,
Okay.
sometimes it's
yeah,
just
that's
having,
fine.
sorry, I was
Sorry.
going to say, sometimes it's just having the conversation with that person, isn't it? If you do have an episode, what would you like us to do? And
Yeah.
if they don't want the first aiders to know, it's making them aware that in that event, we're very likely to call an ambulance or,
Mm,
Yeah.
this is what we will have to do for your own sort of safety. And it's sort of having that conversation with them, isn't it?
Yeah.
mm.
Okay. Great. Thank you, Auriel.
Fantastic. That's all right. You're welcome. Thank you, Georgina, for asking that question. That question. Yep.
Any other questions at all from anybody else? Anything anyone wants to cover? Feel free to pop them in the chat if you'd rather not put your microphones on. We'll give you a couple of minutes just in case it's delayed. Um, as we say, we've kind of come to the end of the training, so I'm happy to turn the recording off in a moment and hang around if anybody wants to talk off camera. Oriel's details are on the screen, and obviously you've got our details already. But I think the important thing is, as we've just seen, with the example that Georgina raised, it's just about being proactive and opening up those conversations and creating that kind of safe space that people can talk to you and they can tell you what they need. And keep it individual, as we've been saying, don't stereotype that all people with type 2 will need this or all people with this condition will need this, and just have those sort of conversations with your individuals about what they need themselves.
Yeah, if I could just add something, if I may, Tracy. If any of you employ agency staff to work within your company, it's a good idea to have an agency or contract risk assessment that that person fills in. Don't rely on the agency to fill that in for you. Because again, you can have a diabetic employee that is working there as an agency staff, something happens, and again, that could land at your door with a claim without you recognising it. So that's also something, even if they work on your premises for one day, they've still got that liability there.
Yeah, definitely. It's a good point. It's about considering all of the risk, isn't it, across all the
That's
workers, all
it.
the shift.
Yeah.
Okay, brilliant. Well, we will stop the recording and turn the slides off. Like we say, we will hang around for a few minutes. So if anybody wants to discuss anything else, you're very welcome to. And if not, feel free to leave as and when you're ready. And thank you to Oriel for joining us and for the information. Oh, Michael, have you got your hand up there? Was that a goodbye or was that a question? I think it might have been a goodbye.
I think it might have been a good
I
fight
think
with
it was.
thumbs
If you've
up.
got a question, Mike, just jump in. Okay, I'll turn the
Yeah.
recording off now, but like I say, we're still here.